Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Harper. Today I'm going to walk you through your consent form for thigh lift. If you have any questions while reviewing this form, please enter them in the portal below, or feel free to ask them in person if you prefer. Let me start by explaining what this procedure is designed to help with. Thigh lift is a procedure used to remove excess skin and fatty tissue from the inner thighs to create a smoother, firmer contour. This surgery is usually chosen when loose skin has not improved with weight loss, exercise, or time. It is important to know that this procedure is not a treatment for being overweight, and the best results usually happen when your weight is stable before surgery. In some cases, this can also be combined with liposuction or other body contouring procedures depending on your needs and goals. And now let me walk you through what happens during the procedure. During thigh lift surgery, I remove excess skin and tissue from the inner thigh area and reshape the contour to improve the overall look and feel of the thighs. The exact technique I use depends on how much looseness is present, your body shape, and the result we are trying to achieve. In some patients, liposuction may also be part of the plan if there are areas of excess fatty tissue and the skin quality is appropriate. My goal is to create a smoother contour while keeping your outcome balanced and natural for your body. Next, I want to go over the most important risks. Like any surgery, thigh lift does come with important risks to understand. These can include bleeding, infection, swelling, bruising, scarring, delayed healing, fluid buildup, skin numbness or sensitivity changes, contour irregularities, asymmetry, tightness, wound separation, and discomfort during recovery. Some patients may also notice bunching near the incision lines, changes in skin color, or areas of firmness as healing continues. More serious but less common concerns can include blood clots, lung or heart complications, tissue healing problems, long-lasting swelling in the legs, and other unforeseeable complications that I cannot predict. Smoking, nicotine use, certain medications, and some medical conditions can also increase the risk of healing problems, so it is very important that I know your full medical history before surgery. Let's also review the possible benefits and the other options available to you. The main benefit of a thigh lift is improving the shape of the inner thighs by removing extra skin and creating a firmer, smoother contour. Many patients choose this procedure because clothing fits better, movement feels more comfortable, and the thighs look more in proportion with the rest of the body. Alternatives may include choosing no surgery, continuing with diet and exercise, or using liposuction alone in selected patients who have good skin tone and more limited areas of excess fat. Each option has its own strengths and limitations, and choosing no treatment is always a reasonable option as well. Here is what you are agreeing to when you sign this form. By signing, you are confirming that we have reviewed the purpose of the surgery, the expected benefits, the possible risks, and the available alternatives. You are giving me permission to perform your thigh lift as discussed, and you understand that healing is different for every patient and that no surgery can promise perfect symmetry or a perfect result. You also acknowledge that additional treatment or future revision surgery may sometimes be needed and that following your aftercare instructions carefully is a very important part of your recovery. Your signature also confirms that you understand the risks of anesthesia and accept responsibility for the financial obligations connected to the procedure and any future care that may become necessary. Before you finish, let me bring everything together. Thigh lift is meant to improve the contour of the inner thighs by removing excess skin and reshaping the area, especially when loose tissue has not improved on its own. It can offer meaningful improvement, but it is still a real surgery with recovery, limitations, and risks that need to be understood clearly. My goal is for you to feel informed, comfortable, and confident in your decision before moving forward. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.